Hello everyone. My name is Michael and I am an international student at University Kebangsaan Malaysia, also known as UKM. Today, I am presenting my individual video report for the course SKPW 1113, Introduction to Social Work. This assignment requires me to discuss how a specific target group is managed using the social work case management system. According to the Department of Social Welfare, or JKM, there are 8 main target groups in the social work profession in Malaysia. These groups include children, the elderly, disabled people, poor families, and victims of violence or human trafficking. For this presentation, I have selected the group of people with disabilities, who are referred to as OKU in Malaysia. People with disabilities face many complex issues in their daily lives, especially regarding employment. First, there is a significant amount of social stigma. Many employers believe that OKU individuals cannot perform tasks as efficiently as others, which is often a mistake. Second, there are physical barriers in the environment. Many modern office buildings still lack basic accessibility features like ramps or elevators for those who use wheelchairs. These combined factors make it extremely difficult for talented individuals to find work and achieve economic independence. Without a job, many OKU individuals suffer from low self-esteem and financial stress, making them feel isolated from society. Let me introduce my client, Ali. Ali is a 24-year-old man who graduated with a degree in graphic design. He is very creative and skilled in digital art. However, Ali has a physical disability that requires him to use a manual wheelchair for movement. For the past 14 months, Ali has been unemployed despite his best efforts. He has attended many interviews, but he often finds that the offices are located on higher floors without elevators, or the entrance has steep stairs that he cannot climb. This has made Ali feel very discouraged. He currently lives with his aging parents and is worried about his future and his ability to support them. To help Ali, we must apply the social work case management system. According to Barker, this is a procedure for identifying, planning, and monitoring services provided by social workers or agencies for clients. This system is grounded in professional knowledge, values, and ethical codes. The purpose is to ensure that the client receives services that are well-planned and competent. In Ali's case, one agency will take primary responsibility and assign a case manager to coordinate his services and guide him toward his goals. This system helps the community understand the professional role of social work in managing complex cases. The first stage of the system is intake and screening. During this stage, social workers are required to identify cases that are suitable for intervention. The work process involves a careful review of the referred case documentation. For Ali, the social worker checks if his needs match the services provided by the agency. Since Ali's unemployment is caused by environmental barriers and requires long-term support and regular monitoring, his case is accepted into the system. This first step is crucial because not all cases require a full case management system, but Ali's situation clearly does. Stage 2 is the assessment process. Social workers must perform a systematic information gathering process to gain a comprehensive understanding of the client. For Ali, we identify his primary problems and needs. We also look at his resources and strengths, such as his education and professional design skills. This stage also includes assessing risk situations and determining the functional perspective of the client. By understanding both Ali's challenges and his talents, the social worker can build a strong foundation for the next steps in the intervention process. Stage 3 is planning and intervention. The social worker must collaborate with Ali to develop a case or action plan. This plan must include goals that are achievable and measurable. We define the roles of both Ali and the social worker in this process. For example, our goal might be to secure a remote design job or a position in an accessible office within 3 months. We determine the best strategies, such as contacting inclusive employers and applying for financial aid or the JKM allowance. Then, we implement these intervention strategies collaboratively. Stage 4 is monitoring and evaluation. The social worker must continuously engage in monitoring the implementation of the case plan. We identify the scope of monitoring and determine the appropriate methods. This involves conducting progress monitoring and preparing reports to track Ali's development. We evaluate if the services provided are effective and if Ali is getting closer to his goals. If Ali faces new barriers, we review the planning and intervention processes and make modifications when necessary to ensure success. The final stage is stage 5, which is termination. Social workers must prepare for case termination by discussing progress and changes with the client. We assess if Ali is ready to continue functioning independently without further intervention. In Ali's case, once he has secured a job and feels confident in his workplace, we reinforce his future plans. We then prepare the final document for case termination. This marks the end of the formal case management process, as Ali is now successfully integrated into his professional environment. In conclusion, the social work case management system is an essential tool for providing professional and ethical support to the target group. It helps people like Ali move from a state of dependency to a state of self-reliance and empowerment. This system ensures that social work services are implemented with high quality and competency. Finally, I would like to state that this video was prepared using AI tools ethically to assist with voice and visuals, following all academic procedures. All information presented is based on the Social Work Case Management System Manual from JKM and University lecture materials. Thank you for your attention.